Welcome back to Medical
Welcome
Monday.
back, yes.
Today's topic is very popular because of the things that we do, whether it's so much office work nowadays or that everybody's driving. And you know how many people typically get in an accident during their lifetime? About three-quarters of all people that drive.
75 to 80% for sure.
Will get into an accident and cause neck pain. So we're going to talk about neck pain today. It's very important because neck pain can sometimes not just be right there, but it can lead to other conditions. And what's oftentimes seen with neck pain is it's untreated and it gets progressive.
That's very true. Most of our injuries are untreated. As children, we don't share it. We don't talk about it. We just kind of say, I'm fine.
Or as a guy, it's like, no big deal. I just keep working.
Just rub some dirt in it.
Just rub some dirt on it. But if you've ever said that before, you know what you really need to do right now is think about liking and sharing this video because you're not the only one that's thought like that.
Correct.
The more information that we can spread, the better off it'll be so that all your friends and family and loved ones will also get this information and not do what we typically do and just say, it's no big deal.
It's no big deal. I'm fine. So don't be fine. Like and share because somebody out there
spread the word.
Be helped by this.
But what is actually consistent of the neck when we talk about neck pain?
So when we talk about the neck, what we are talking about are 7 bones below our skull. I even brought props. I brought props today. So just like the picture behind us, we have the skull, right? But the very base of the skull sits on top of 7 different bones. And that is what consists of our neck, our 7 different vertebrae. Each one has its own purpose. And believe it or not, there's some regions to the neck that allow us to do certain movements. Most of rotation is actually done within a few segments. Most of our side bending is done by a few segments. And the same thing when we talk about forwards and backwards. Those are actually done by just a few segments. So each region of the neck has specific movement parameters that's what they specialize in regards to that.
Just like certain areas of the neck, if you look here, that natural curve, certain areas are for weight bearing, which is the back, that you can actually feel those bones. That's where the weight bearing should be, not on the front. Oftentimes in patients, you feel their head going further and further, and then sometimes you'll see like grandma might have a hump in a part of her back right here, and that's just part of that overhead movement that's not natural, and now their weight bearing is off.
Correct. Pull it back. Pull it back. Well, what lets us pull it back?
Muscles.
So yes, those bones that we just went over are actually surrounded by muscles. Muscles allow our joints to move. Muscles let joints move. And so muscles are very important in the process of movement, of recovery, of strength. And so yes, the muscles hold the bones in place, but they also
part of the injury. That's a lot of times what happens is the muscles get injured.
Yep, and the longer that the muscle is injured and there's scar tissue in there, the more degenerative change happens when we talk about some older injuries and things like that, which we'll hit on later. But then also, what lets us communicate, right? What allows those muscles to move?
Nerves.
Yes, exactly. Nerves are where function comes from. And when we talk about function, it can be sensory. Can you feel this? Is it hot or cold? Can it move, right? We have nerves that go to our muscles and allow them to move. But then we have functional nerves that allow organs to work. And all of that comes through our nerves. Yep. So there's some basic things about the neck.
Those nerves come out of spaces that need to be created, natural spaces that unfortunately can go away if these injuries don't get treated. That's where we get that arthritis or degeneration in there.
Yep.
Those nerves need the space, and they're supposed to have that space.
It's like a clear movement for them to go. So we've talked about a couple of different things already in regards to anatomy, but we've also talked about a couple of different injuries. So one of the big injuries that we see is whiplash. We talked about how many people have been in accidents, right? And we're not even just talking about car accidents. That is one of the most common times to get whiplash. But if you've ever been tackled, if you've ever been startled, if you've ever fallen, that's a type of forward, backward, very sudden impact type movement. And whiplash is a very common injury that occurs when we talk about neck injuries. We also have things that can occur later on because of injuries, degenerative change, and those are called radicular symptoms, cervical radiculopathy. That's typically when, because of something to the neck, it's going down into the arms. And so you're like, oh, my fingers are tingly, or
I've got numbness down my arm, or sharp shooting pains down my arm.
Exactly.
Because that nerve that comes and is supposed to function with this arm comes out of the neck.
Yep.
If it starts losing that space and starts getting pinched, that's where you get dysfunction further down that chain.
Yep, and so it causes issue. And then we can have this is like a hyperstretch type injury where there's damage or irritation done to the nerve due to overstretching. And so it's pressure on the brachial plexus. And that is, we talked about different types of function that nerves have. That's when different types of function is affected by the nerve itself. So you can have a compression or an overuse type injury. But then also you can have headaches. Headaches can actually be coming from your neck. So believe it or not, even though you might not have neck pain, you might have
tension headaches are one of the most common headaches, and that's from, we say tension, of course. That's why it's called a tension headache. Well, muscles, they have a start point and an end point, and they connect between two bones. Well, what they do is contract so that you can move those bones, but if there's scar tissue or just natural atrophy, damage, they naturally get shorter on their own, these muscles do. And that creates tension and where they're connected from point A to point B, and that tension is oftentimes brought on to a form of a headache.
Yep. And they're very unpleasant. Most people don't like getting headaches.
Nope, not at all.
But we also have degenerative change. We've talked about a lot of different injuries like whiplash. We've talked about scar tissue in the muscles. If that is not addressed and taken care of properly is when we get these arthritic changes in the neck.
And you can see a healthy neck here. There's a big hole to where that nerve can come out the way it's supposed to and function and communicate down your arm. Well, if it starts getting pinched off because of that arthritis, that's where you get dysfunction going down there.
And then a lot of times when we have this type of dysfunction or some of the injuries that we've talked about, we end up with herniations. And that is when part of the disc space comes out and pushes on the spinal cord itself, or even the nerves that Lonnie talked about when they come out of those natural holes that exist to allow the system to function properly. So lots of ways that we can injure ourselves and have specific neck irritation or neck pain. And so there's a lot of things that you can do at home to actually help.
The neck is complex, but the neck is no different than anything else in the simple fact of it's bones and muscles. Anytime there's an injury to a muscle, the acute injury, what do we always say to do?
I don't know, Lonnie. What do we always say to do?
We always say, put ice on it. That ice is going to relieve some of that swelling and give you some comfort. When that swelling occurs, that's when there's pinching of the nerve, and that's where you get that pain sensation from, is from the swelling. So ice it.
Yes, ice, baby. Ice it.
It'll help bring that down and bring you some comfort and some relief so that, the acute injury is one thing, but it needs to start healing. And as soon as you can get that swelling down, the sooner the healing can start.
Yep, very, very true. The other thing we can do is move it. Stretching is so imperative. You've got to use those muscles. My favorite statement is, well, it's not my favorite statement, but it's a very true statement. If you don't use it, you lose it. And it's very, very true when we talk about muscles and movement in the neck. If you're not moving these muscles, if you're not stretching your neck, you're going to lose that movement and that function. It's such an important aspect of what needs to happen.
We talked about earlier with headaches. There are oftentimes tension headaches. When that muscle gets very tight, it creates tension. You need to stretch and relieve that tension, not only from just within your neck, but the surrounding muscles of your shoulders and your shoulder blades that can contribute to more neck problems.
Very, very true. Very true. And then also, one of the big things is modify what causes the problem. Modify. If it's the pillow you're sleeping on, then get a new pillow. If it's the workstation you're at, then change your workflow. There's just so many aspects. So you've got to plan, you've got to do, you've got to try it, we've got to change it. We need to review it, and let's see what's going on. So like it's a little bit of a process to get through, but the thing is if you know what causes it, then how can we modify that to make it better so that you don't have the same types of problems that have been existing for quite some time? So that's a big one.
So you tried a lot of things at home. We look at our stretches. We ask a friend. We're doing the activity plan changes that we need to do so we can get good neck comfort. But it's just not getting there.
No, I just need a little bit more help.
Just need to push more. And what do? We go to some professional help, and oftentimes maybe your primary or urgent care. First things first is they're going to go, let's stretch and strengthen those muscles with professional help, i.e. a physical therapist, so that you can get proper stretches and relief within there. After the stretches, after some good medical, what do we say? Monitor would kind of be the way, but also, monitor is a good way to put it, but it's also supervised to where we ensure that you're not doing too much. Because sometimes, we as patients, we want to do too much and we can injure ourselves. So that supervision is kind of like mom and dad kind of pulling us back and saying, let's not do too much. But if you are in physical therapy and maybe it's painful, so what do we need to do? Your primary can give you some medication or advise some over the counter just to make it comfortable so that you can get through physical therapy, and then hopefully you can stop it in the short term.
Mm-hmm. Yep. And then typically when that's something that doesn't quite help anymore, or you just the damage might be a little too far, then some type of a steroid injection or nerve block type injection to really get you that relief that's needed so that you can get that strength back. So all tools, right, to be able to function, to be able to strengthen, to get back where you need to be. So those are some great things. And then one of the things that does happen occasionally, sometimes due to extreme trauma, but sometimes just because it's just a little too far gone, is surgery. Every now and then it's needed. It's not our favorite thing to see. We always want to help and get patients to avoid surgery, but it is a needed service sometimes to stabilize and take care of it. So those are...
But you look at your traditional or typical things that you can do at home along with some other health professionals. But what are some of the specific things here that we can help patients with that may not be known?
Yeah, absolutely. So we've actually gone over some of these, but what's great about our office is that it's taken care of here in-house, and that's rehab, exercise. We were talking about this before the show. When is the best time to, to take care of an injury?
When do you do rehab? Do you do rehab after an injury?
Yeah.
Or should you do rehab before an injury so that when you have an injury,
then you can recover more.
You can recover much faster and not as much dysfunction.
It was a very, very... it's a very good point, right? And so we have rehab here. We do rehab because we want, whether it be pre or post injury, we want to be able to strengthen and increase range of motion. Those muscles need to engage properly to do their job. That's what they're there to do, is a job, and that's to move and to help you function.
And of course, it's medically supervised. It's here in-house, trained staff. Not just a generic overall physical therapy, but physical therapy specific to the back, the neck, the major areas that we work with
absolutely.
here.
The muscle groups that need to be taken care of. So we have specialized rehab mats. We have specialized equipment for spinal rehab and getting movement and life back into those disc spaces. So phenomenal setup to take care of that. We mentioned the disc space, right? So we have specialized equipment to help rehydrate discs and to get movement in those areas. So even though there's arthritic change, what that means is we need to get movement in those joints. And that's very, very common, the belief that, I have arthritis. Okay, but we can still move that joint.
Moving that joint helps pump that disc and provide good fluid, healthy fluid that can lubricate that space so they move better, less pain, and more range of motion. That's all that you need to do, is continually pump that motion to where that disc can be very happy and lubricate that space for you.
Yes, very much. Well, and you talked about make that disc happy. The muscles are not so happy as we go through this process. So what's phenomenal is sometimes you come in a state where you need a little extra help with the muscle spasms, or during the process, those muscle spasms start happening because your body says, I haven't been using this muscle and I'm not sure what to do anymore.
Stop.
And patients feel it. So we do have some phenomenal trigger point injections that help to reduce that spasm.
And they're natural trigger point injections. You always talk about medications that can be given, and they do great things, but then there's also side effects. We really want to lean towards natural selection of medications to where there's very minimal side effects. Really the only side effect with this injection, it's just a little pain at the injection site, which is no different than any other needle being used. However, it's a very small needle, but it's a natural injection to help relax those muscles so that you can get movement within that joint space. The better movement you can get from relaxing those muscles, the faster their recovery is going to be. So it's kind of all encompassing together. And that's the good thing about a comprehensive plan under one roof.
Yes, very comprehensive. And then one of the other things we do is we focus on adjusting the spine and getting that movement in those joints. All encompassing, right? We want to strengthen the muscle and work on that. We want to make sure that we get movement in the joints. We want to make sure that we support the muscle and relax the spasms so that you get the best recovery, so you can engage properly, so you can get back to those activities.
A domino effect.
Yes, it is in the reverse effect, right? It's the opposite.
But what about if somebody doesn't want to get their neck
Absolutely.
cracked and popped.
It's very common. It is a very common request that we see, whether it be because of the state they're in. They're like, oh my gosh, please, there's no way anything's going to move. But the other aspect is just the fear of having their neck rotated or adjusted manually. And what's great is we actually have specialized equipment to perform a very gentle and specific neck adjustment throughout the spine, actually. So it doesn't even just have to be done to the neck. It could be through any vertebra on the spine. So specialized equipment to be very gentle and specific, just to get movement. It's important to get movement.
With these, you're not using your hands to twist somebody's neck.
No, I'm using the tool in my hand, and then there's a prong, a fork here that you can see, the smaller one, that's specifically designed to just go around each vertebra and get movement. Get movement. And it's very gentle, phenomenal responses in regards to patient care and how they
just hearing that you don't have to crack somebody's neck, that's worth share right there.
Yes,
how many people are worried about going to the chiropractor and have their neck cracked?
You can do it without that. It's a common concern. It's a very, that's something
that's reason alone for a share right there.
And some patients only want that manual adjustment, right? And some patients...
It goes to the left or to the right. It's big extremes.
We take care of all those extremes. We want to make sure everybody gets the best care, and that's very true. So,
talking about best care, really today is a whole lot about best education. I hope you guys learned a lot about what neck pain is, kind of where it comes from, along with the factors that can increase recovery, and then also the reasons why we want to have recovery much sooner so that it doesn't deteriorate down to that picture. Remember the one with the neck that had like 7 giant pieces of metal fusing it all together? Not a good thing. So we want to prevent that. We want to give you guys all the information so that you can take care of your neck. Whatever options you decide to choose, know that they're yours, and that we want to support you and at least give you all the information that you need. If you enjoyed today's video, like we said,
like it and share.
Share it with any friends, family members, so that they can also get the good information.
Yes.
Until next Monday, see you.
We'll see you then.